Since the 1970s, the ability for us to remove fat in isolated areas has improved markedly. And a lot of it has to do with technology, some of it has to do with our understanding of how people store fat, and then how we remove the fat. Now we use tumescent solution. That started in the 90s. It has adrenaline in it. It decreases the bleeding, has local anesthetic to decrease the pain afterwards. So the technology's improved, our understanding's improved, and I think patients understand better what to expect from it as well.
You just said local anesthetic. You don't have to go under, so to speak?
We do a blend. We have local anesthetic that's injected at the time of, and then we have an anesthesiologist there, a board-certified anesthesiologist to watch over the patient. Most people would like to be sedated. Some areas I can do with the patient that's just under local anesthesia, but most people have sedation, maybe like they'd have with a colonoscopy.
What is the downtime?
The downtime depends on the number of areas treated. The more areas you treat, the more sore you're going to be. It's nothing like the downtime from, let's say, a tummy tuck, though. The incisions are small. You have bruising, swelling, but the garment that you wear, I have you wear a garment for a few weeks afterwards. You could be wearing a suit. You could be wearing normal clothes. It's able to be easily worn without anybody know that you're wearing it.
And what do you think is the benefit for the patient? We're talking about, again, a procedure that has been somewhat controversial over the years, but less controversial now. You've talked about the advances in the science of it. What about the psychology for patients who have the need to find a way to lose weight that cannot seem to do it through normal means?
So what this helps with is the genetic fat deposits, the ones that will not go away with diet and exercise. And so we all have those areas. We have to have basically marked weight loss almost to get rid of those. There's patients that come in and say, you know, I'm almost at my ideal body weight, or sometimes at it, and they still have isolated fat deposits of their flank and their abdomen. They got that from their grandparents. They got that from their Aunt Minnie. They got it from somewhere. The body does not respond to diet and exercise in those areas like it does everywhere else. So somebody may lose 40 pounds, they still have the excess on their abdominal wall, and that's the last area, and it's sticking out. So it makes it so we can remove that fat, and then they're more concordant. Everything matches much better.
For someone who works out over and over and can't lose that last 10% that you're talking about, you are making best friends for life, aren't you, with these procedures?
Yes. So that fat we feel like is basically metabolically different. It probably looks the same under the microscope, but it doesn't respond to diet and exercise. That may have to do with the fact that, you know, whenever in the past history, people went long periods of time before they could eat, and so they had to store the body's stored fat. So now, when we diet and exercise and we get down to that last area, it's very frustrating. We can make that much better.
Someone sees this, they want to call you and make an appointment. Give me the sense of what kind of timeline we're talking about and the 3 most important things they need to think about when they call you.
Well, so when they're coming, they need to decide, you know, what areas bother them. If they have any medical problems, then I need to know about those so I can have their physician evaluate them beforehand. And then when they come, the day that they come, they can show me the areas, and then I will go over with them their recovery, the cost of things. Everything's done in my office, which is very nice. They never have to go to a hospital. Their lab is drawn next door at a clinic. So it's all self-contained. We're able to do this in a very comfortable environment. They come in and have it done. We watch them for a little while. They go home. We send them home with pain medicine. And then over the next few days, they increase their activity. I'll let them start working out again lightly at 2 weeks.
And finally, the emotional effect this has on these patients of yours.
Oh, if it's something they've been struggling with for years, it makes them feel so much better about themselves. It gives them more self-confidence, their clothes fit better. There's nothing bad about that. It's a very, very positive experience.